actually was in the building for something else. I walked by and good to see you all. Thank you for what you're doing. You know, we're obviously right in the middle of this now. We had a meeting yesterday. I'm on the health, there's two committees doing the health bill. There's the Baucus Committee and the Kennedy Committee. The Kennedy Committee's, we're writing a much better bill than the
I would
Baucus
imagine.
Committee. We all agreed, all 11 Democrats agreed yesterday on the public plan was written by Sheldon Whitehouse and me, the public option that we're doing. It's not quite as strong as I want, but it's good. It's solid. And that was the 11 Democrats all agreed on this public option plan, and it's going to be run. I mean, this is what we're going to vote on next week. I don't want to give a lot of details yet, especially since you're filming it. And, I'm not right there. Yeah, but she's a lot higher tech than you. I know you won't be able to figure it out. But anyway, so I think it's good. It's solid. We're gonna do the markup. We're out of session this coming week. We're gonna do the markup next week on the final part of the bill. We did the preventive care. We did the community health workers and other workforce issues. We did the quality section, the fraud and abuse section. The section we haven't done is the most complicated and the most expensive, obviously, and that's the coverage itself. But I think you're going to be pleased generally with it. I know the President's going to weigh in with all of you. The more that you do that, the better, because this is going to be hard. It's going to be hard to keep every Democrat, and it's going to be hard to win Republicans over. The Republicans say they want to work with us, but they just automatically say no to the public option. I mean, if we had waited for bipartisanship, we never would have gotten Medicare in 1965. And I want to work with Republicans. We accepted many of their amendments last week on some of these issues, which we thought were good amendments, regardless of who introduced them. But on the major issues of coverage for everybody, of public option, of several of the $8 to $10 billion a year for prevention. We're not compromising on those, because those are what you all campaigned for last year, and those are what you stand for, and this is what I stand for, and we're going to change this healthcare system as we're changing the country. So thanks again for all you're doing. You matter so much. You mattered in '06 in my race, and in '08 with the presidential race, and so the memory for each of those two nights was in '06 when the check mark went next to my name, and then '08 when it said Ohio for Obama. That was a pretty exciting moment, both of those. And so this really is going to, in the end, we so need the White House to engage, and his engagement, a big part of that is your grassroots engagement. So we really need you, and keep doing it, and we're going to make this happen. So thank you.